Dr. Daniel Amen is a psychiatrist, brain imaging expert, best-selling author, and medical director of the Amen Clinics. He has pioneered the use of brain imaging in clinical psychiatric practice and is a noted expert in the field of the brain and behavior. Dr. Amen's breakthrough research and insights provide hope and more effective treatment for millions of people today.
There are many people who are anxious or depressed or obsessive, prone to anger, they have attentional problems, and they thought their problems were all in their head, purely psychological, if you will. In the research that I've done, what we found is that these and many other problems are brain-based problems, and that when we optimize the brain, their lives become better. We often say, change your brain, change your life, and that's what we've seen. Well, today we're going to talk about anxiety, depression, and bipolar disorder, and we're going to talk about them from a brain perspective, and we'll also talk about how to treat them effectively. I like to start with this case because Tommy read my book, Change Your Brain, Change Your Life, and was able to diagnose himself. And I like that. I was in the Fairfield Clinic, our Northern California clinic, last year, and my office manager grabbed me and she said, "You have to see Tommy." And I said, "Why?" Because I was busy. And, "Oh, you have to see him. He's from Orlando, Florida. He's very cute, 9 years old. He read your book, Change Your Brain, Change Your Life." I'm like, now I'm paying attention. And she then said he sleeps with the book, which made me think he's a weird child. And so I went in, I met him, 9 years old, cute as a button, big blue eyes, blonde hair. And he said, "Dr. Amen." He recognized me from the picture in the book. "Dr. Amen." He said, "I have a left temporal lobe problem." I said, "Really?" So how do you know that? He said, "I read the book. I took the checklist in the book." I said, "But how do you really know that?" He got thoughtful and he said, "I have a bad temper. And I don't want to have a bad temper." And you say in the book, people with bad temper sometimes have left temporal lobe problems. He said, "And I used to see ghosts." I said, "What do you mean you used to see ghosts?" He said, "I used to see these green things float in front of my eyes, the green clouds, and I didn't know what they were. I thought they were ghosts, and they used to scare me." And he said, "And last year I tried to kill myself because I had such bad thoughts in my head." And you say suicide is often associated with left temporal lobe problems. Doctor had put him on Prozac, made him significantly worse. And so I said, "Well, Tommy, have you seen your scan?" And he said, "No." And what you're looking at are SPECT scans, looking at blood flow and activity patterns. And the image on the left is a healthy scan, full, even, symmetrical activity. It looks really pretty. Look at the image on the right. This is a 9-year-old scan. And if you look right about in the middle, on the right side, you see those divots. It's his left temporal lobe. 9 years old, predicts his own scan. It's amazing. And as he sat there, he was so proud of himself. One, he predicted it. But two, it helped him to get rid of the shame. Because he thought he was a bad boy, or he wasn't good enough, or sometimes it's God doesn't love me enough that God would let me suffer. I opened up my book, Healing Anxiety and Depression, with the story of a woman that had a severe panic disorder. And she prayed that God would take it away. And she still had the panic disorder despite the prayer. And over time, she just stopped talking to God, thought God didn't care. And then when we scanned her, it's like, you have a medical problem. God cares. He just wants you to get it treated. And she had to change her sort of whole perception of how she communicated and talked to God based on the understanding of her underlying problem. A lot of people are suffering with anxiety and depression, the two most common psychiatric disorders in the world, anxiety being one and depression being two. And a lot of people go untreated. So, You've seen this before. The 9-year-old can understand it. Can it really be science? It's a cartoon from Peanuts where Peppermint Patty says, "What are you reading, Franklin?" And Franklin says, "It's a book on psychology. From what I understand, it seems to be pretty good." And Patty says, "Forget it, Franklin. No book on psychology can be any good if one understands it." And that's what we're trying to do in this course, is like get rid of that and make this easy to understand. So, as we have talked about, a lot of my work is based on a study called brain SPECT imaging that looks at blood flow and activity. And it's really easy to understand because we're looking for three things: good activity, too little, or too much. And what we're going to talk about today are the brain systems underlying anxiety and depression and bipolar disorder, and then we'll talk about treating it. And this is the camera. And I hope all of you who signed up for getting Brain in the News are getting it. I've been writing about it. And last week I wrote about technology on Mars. You know, we can take pictures on Mars with spirit and opportunity. And it just really irritated me that, you know, I'm looking on, you know, the front page of USA Today and I'm seeing, you know, red dirt and rocks. And we spend billions of dollars to do that. But yet you can try and kill yourself today in LA. And no one will look at your brain. You know, that we don't use technology for what may in fact be the most important endeavor, which is understanding the mind. Because that, you know, the brain controls everything that you do. Again, just looking at a healthy brain. Now we're looking at the outside surface of the brain. And here we're looking at the top 45% of brain activity. What we see is nice looking brains, full, even, symmetrical. As part of our normal study, we did a normal couple last week. And we're a little hesitant about the guy because we thought he drank too much. We were really right when we saw his scan. I mean, it's very clear he should stop. His wife, oh my goodness, the most beautiful brain next to my mother. I mean, amazingly beautiful. But really, it looked healthy. So here we're looking at the outside surface of the brain, where what you see is full, even, symmetrical activity. Now, what may be more important for today are the hot spots, because we find a lot of different kinds of anxiety and depression are related to too much activity. Okay? Not all of them. As we'll see, they're different types. But what we see in this view is blue is average activity, red is the top 15%. By and large, it is in the back part of the brain. Why? Because that's where the cerebellum is that has 50% of the brain's neurons. Okay? What we see with obsessiveness is the frontal lobes are on fire. We see with people who have panic disorders, their basal ganglia are working really hard. We see with bipolar disorder, the whole thing is hot. It's amazing when you look at someone who's in a manic phase. It's like, that's why you have to calm it down. I put this slide in to just talk about strokes for a minute. Strokes, you know, are where a blood vessel breaks or a blood clot goes and plugs a vein or it plugs an artery and it chokes off blood supply to that area and tissue dies. This is a left-sided stroke. And what we know is that strokes to the left hemisphere cause depression in 60% of the cases. So within a year, if you have a stroke to the left side, you have a 60% chance of getting depressed. That's very important. It's also very important if somebody has a heart attack. There's a very high incidence of depression after a heart attack. And a lot of doctors don't know that. And a lot of families don't know that. I mean, it should just be part of what we tell people on cardiology units. You have a heart attack, you should watch for symptoms of depression, you know, sleep problems, sadness, irritability, suicidal thoughts, trouble focusing where you didn't have trouble focusing before. I have to tell you a sad story. When I was in medical school, my grandpa had a heart attack. And he's just different afterwards. And he had a heart attack on the bottom of his heart. Bottom of your heart sits on a muscle called the diaphragm. That's a big muscle that separates your chest cavity from your belly. And the heart attack there actually damaged a little bit of his diaphragm. And he had terrible hiccups. Because if you damage the diaphragm, it's contracting. It like goes into, he had the hiccups. And he went to doctor after doctor, and finally they actually did a surgery to cut the nerve to the diaphragm. And it helped a little bit. But what I didn't know then is that 60% of people who have heart attacks get depressed. And this very bubbly, sweet, loving man was crying and not sleeping and sad. And nobody knew about it until I read about it. Like, what's the matter with him? Because he was a candy maker. And, he was like a jolly, wonderful grandpa. And it's amazing. People miss that diagnosis a lot. And why is it a problem to miss depression or to miss anxiety disorders? Well, an obvious problem is suicide is the 8th leading cause of death in the United States. That's an obvious problem. But if you are depressed, you are much more likely to have your wife leave you or your husband leave you. It causes great marital strife. And as we go through some of the symptoms, you'll see why it causes great marital strife. They're not interested in sex anymore. They can't concentrate. They're mad. They're irritable. And they put a negative spin on everything. It's like the glass is half empty. And you can fill the glass to the top, and it's still half empty. They can't see what's good about their life. Alzheimer's disease, which we'll talk a lot about later in the course, is a brain disorder. We see bilateral decreases in the temporal lobes and in the parietal lobes. But there's something that looks like Alzheimer's disease that we call pseudo-dementia. And what that means is dementia means losing cognitive ability, especially as you age. It's not due to Alzheimer's disease, not due to a stroke. It's due to depression. That people who are depressed in the elderly may look like they have senility and put them on an antidepressant, and they might get normal. I don't know if I told you, but the first 10 cases I ordered brain scans on in 1991, they were touched by God. I totally believe that, because they were like the coolest, most amazing cases that made me feel like, well, how could I ever do anything else? And one of the cases was Matilda. And Matilda was 69 years old. And she came into our clinic. Actually, she didn't come to the clinic. She came to the hospital because she'd almost burned down her house because she left something cooking on the stove. And she was forgetful. And she had bad judgment. And she was disheveled. And she wasn't taking good care of herself. And she was getting lost. And this one day, she leaves something cooking on the stove and forgot about it and nearly burned her house down. At which point, her whole family gets mobilized. Grandma's got to go to an old folks home, right? Grandma's got to go to a care home, because otherwise she's going to kill herself. And one of her daughters was a nurse and said, before we send Grandma away, we're going to put her in the hospital, we're going to get an evaluation. And just by chance, if you believe in chance, I'd just been to the lecture earlier in the week on brain scans, and Matilda came on my service. And as I was talking to her, it seemed to me like she had Alzheimer's disease. But, I'm not that good at guessing what's going on in your brain. And so I ordered a scan, and it didn't look at all like the one we see on the screen. Her emotional center was really high. And so I'm in the library. What does this mean? And there were some studies associating it with depression. And already by 1991, there were a number of studies saying that Alzheimer's disease was bilateral, both sides, decreased activity in her parietal lobes and in her temporal lobes. And she didn't have that. And so I noticed in her history, one other doctor had thought about pseudo-dementia, put her on a medicine called Elavil, It's an old antidepressant that has more side effects than any of the other ones. And Elavil caused her bladder to stop working. So even on a small dose. So they stopped it, and nobody thought about depression. After I saw the scan, I went, maybe we should try a better antidepressant. And so I put her on Wellbutrin. And Matilda isolated herself. Wasn't talking to anybody on the ward. Just looked blank. After a week, she starts talking. After 2 weeks, she starts socializing. After 3 weeks, she starts taking care of other people on the ward. And after a month, when I'm sending her home, she looks at me and her eyes are now bright. She said, you know, it's like coming out of a fog. She said, Dr. Amen, they took my driver's license away. She'd been in 4 accidents. She said, would you write the DMV a letter for me so I can get my driver's license back? And my first comment to her was, you know, Matilda, I drive on the same highways you drive on. I'll make a deal with you. If you take your medicine for 6 months and you let me rescan you after 6 months and you're better and your brain is better, I'll write the DMV a letter for you. 6 months later, I saw her every month. 6 months later, we got a follow-up scan. It was normal. And I wrote the DMV a letter. And now, what is she? 84. She still drives. Can you imagine if you missed that diagnosis, what happened? She's in an old folks home. And now, she's more isolated. And she's more depressed, which is going to make her look more demented. Her immune system will kill her. Because when you get depressed, your immune system doesn't work right. Another reason it's very important to treat depression, because you're at a higher risk for cancer. You're also at a higher risk for dementia. Now we sort of understand why. Head injuries are so important to depression. Head injuries, especially to the left side. When you get damage to the left side of the brain, you're much more likely to get angry, irritable, be suicidal. So it's very important to think and ask about head injuries. And as we talked about before, more than once, 5 times. Has anybody done that in any of their clinical work? To like go, have you had a head injury? Are you sure? Have you ever fallen out of a tree, fell out? I mean, it's just amazing. You remember Dr. Dworsky, who was here? She got a scan. And she said, no, no, no. The 9th time she said yes. It was so interesting. I was 8 years old. I fell in the tub, bashed my chin. Even if you know, sometimes you forget. And why do people with anxiety disorders or depression use drugs? Help themselves. And what are the drugs that they choose to abuse? Well, some of them use cocaine and methamphetamines because they have overall decreased activity and it wakes them up. Other people use alcohol. Calms things down. It's sort of like putting water on a fire. It's sort of putting poison on fire, but it calms things down. And heroin. It is so interesting. If you have a patient that uses heroin or heroin-like drugs, methadone, painkillers, they often have the kind of depression that responds to acupuncture. Well, how cool is that? Acupuncture increases natural endorphin. So you bet it's a treatment that you should be thinking about in depression. Now what I see as a psychiatrist, patients come into me and they go, you know, Dr. Amen, I had my teeth worked on and the doctor, the dentist gave me Vicodin as a painkiller. And I have to tell you, when I took one Vicodin, I felt normal for the first time in my whole life. do not give them Vicodin. Vicodin's addictive. It's not a good treatment for depression, but what it does is it gives you a hint on what they might respond to, and acupuncture would be one of the first things that I would think about. People with anxiety disorders use marijuana because it settles them down. People with depression use marijuana because it settles them down. The problem is it settles everything down. And, the people who've smoked a lot of pot over their life, almost all of them complain of memory problems because it damages activity in their temporal lobes. Now I want to go over 7 different types of anxiety and depression. One, I want to leave you with the idea that they're not one thing. They're not single or simple disorders. They're complicated disorders, and you need to know what you're treating. And I think giving somebody the diagnosis of depression is like giving them the diagnosis of chest pain. So why don't we give people the diagnosis of chest pain? It's too general. Why else? The symptom. It doesn't tell you what's causing it. I mean, what are the things that can cause chest pain? Heart attack, anxiety, panic disorder. I'm sorry? A muscle tear? You bet. You have a rib injury? You tear the muscles between your ribs? What else? The heart, bone, brain, stomach, indigestion. You can have reflux esophagitis. Have a kidney ailment that causes chest pain because they're up high in your back. You have a spinal problem that causes indigestion. But what we do in mental health is go, oh, you're depressed. Take cognitive behavioral therapy, you'll be fine. It's a little on the simple side. Right? You want to find out what's it from. What are things that can cause depression? Primary etiologies of depression, what can they be? Be your thyroid. Thyroid's low. Or it can be high, and you are freaked out, having panic attacks all over the place. So it could be from your neck. What else? You can have emotional trauma. That can cause anxiety and depression. You bet. What else? Physical things can cause anxiety and depression. We talked about thyroid. Did you know that the most common presenting symptom for pancreatic cancer is depression? You get a 65-year-old with new onset depression, never had depression their whole life, somebody needs to do an MRI of their belly. Don't just put them on Prozac. You have to think about what are the other things that can cause. Anemia can cause depression. Liver problems can cause depression. You can inherit depression. I mean, it can be what we think of as a primary depression, but it's important to think of these as symptoms, and you want to be much better at describing what are the underlying causes. In my imaging work, I found anxiety and depression are not single, simple disorders. And you shouldn't even talk about them separately because they occur together more than they occur separately. If you get the diagnosis of a panic disorder, 70% of the time you'll also meet the criteria for depression. If you get a diagnosis of depression, about 75% of the time you'll also meet the criteria for an anxiety disorder. So to talk about them as if they are separate or simple disorders is silly. Now, in looking at the different types, when I listed them, I actually listed 2 pure types because sometimes you see them. But of all the types, the first 2 are the least common. Type 1 is what we call pure anxiety. And that's where we see the only things that we see on the scans, basal ganglia are fired up. And the basal ganglia, deep structures in the brain. There are 4 different parts to the basal ganglia. The things that we can see on scans are the caudate, called the head of the caudate nucleus, a large structure. It's involved in thought anxiety, we think. And the putamen, a little bit farther back, is involved in motor anxiety. So when people get anxious, they have motor symptoms, right? I mean, what are some of the motor symptoms associated with anxiety problems? Well, you bet. Biting their nails. Muscle tension, so they get headaches. And those headaches are typically called tension headaches. And it feels like there's a band around their forehead, like somebody's got a vice squeezing their forehead, and somebody is in the back of their neck digging their thumbs into that muscle in the back of your neck. So, bifrontal and upper neck tension. What else? Physical symptoms associated with anxiety. Stomach aches, very common. They have butterflies. What else? Chest pain, you bet. We just talked about it. Chest pain. And then, if they hold their hand out and they're nervous, what happens to their hand? Shake. Sweating, you bet. So they have a lot of physicals. And we talk about this thing called somatoform disorders. And what does that mean? It means your medical illness is basically due to your level of anxiety. And when we see overactivity in the basal ganglia, we often see people, one, who are worried about their health, and two, they tend to have more physical stress symptoms, like irritable bowel syndrome can be a physical stress syndrome, or chronic tension in their body. Just as a review, the basal ganglia integrate feeling and movement, sort of control the body's idle. They modulate anxiety, involved in continuous smooth motor movement, so they're involved in handwriting. Think of them mostly involved with motor function and anxiety. So when they work too hard, people feel anxious. Now, they're also conflict avoidant. Why are they conflict avoidant? Because conflict gets their heart going fast and reminds them of when they were anxious. And they do everything they can to avoid feeling anxious. So they won't confront people. So these are, in an intimate relationship, this is someone who won't talk about the things that are bothering her and won't talk about it. And then all of a sudden, she explodes because she just can't, keep it in anymore. Or she has a lot of headaches because she won't talk about what's going on in their relationship. And so, not tonight, honey, I have a headache. Maybe due, not because she's married to a difficult person, but she's trained him that she won't deal with anxiety. So he always gets his way. But she's chronically irritated, but not sharing it. And so, can you see how, in a sense, her anxiety trains him to be more difficult than he needs to be, because she's never said anything like, don't talk to me like that, or I don't like it when you do that. So he has no clue. They predict the worst. They are filled with what we call ants, automatic negative thoughts. And the automatic negative thoughts that people with anxiety disorders have are fortune-telling ants. They predict the worst, and then they make it worse. We're going to spend some time talking about ant therapy today. Sometimes their basal ganglia work so hard, they just can't stop working. They're like the Energizer Bunny. Now, if the basal ganglia get hurt, or they're too low, as happens in Parkinson's disease, they have low motivation. They have low energy, and they often get depressed. So pure anxiety, what you're going to see are both physical and cognitive anxious symptoms. Nervousness, panic attacks. They avoid situations that they think are at all going to make them nervous. They have a lot of muscle tension. Their heart pounds. They have nausea, dizziness. Masterful at predicting the worst. They have fears and phobias sometimes. They avoid conflict. They're so worried about what other people think of them. So I teach them the 18-40-60 rule, which says when you're 18, you worry about what everybody's thinking of you. When you're 40, you don't care what anybody thinks of you. And when you're 60, you realize nobody's been thinking about you at all. People spend their days worrying and thinking about themselves, not you. But they don't know that. I mean, they're just racked with social anxiety. They startle easily. They freeze more in social situations. They're shy, they're timid, easily embarrassed. And they sometimes bite their fingernails. A whole bunch of DSM-4 diagnoses that would go with this type, but mostly generalized anxiety disorders, somatoform disorders, phobias, and often panic attacks. So how you treat this? This is actually my least favorite type to give medication to. You can do very cool things with this type. Cognitive behavioral therapy, we call it ant therapy. Teach them about their thoughts. They don't have to believe every thought that goes through their mind. Meditation, hypnosis, relaxation, biofeedback, all are self-regulation techniques. I have to tell you, I was here for my 25th anniversary. And one of my friends, when I was here, "Oh, you do hypnosis?" Like it was of the devil. You know, aren't you opening somebody's mind to the devil? And I got incensed. I said, I don't do that to people. I said, you think God is going to use me to open up some... And I just think it's a silly argument, to tell you the truth. Hypnosis has been part of medicine for a very long time. It's very powerful. And if you use it in the right context, you can help somebody really get in touch with themselves. And you can get access to memory that you couldn't get access to otherwise. So in the right situation, I mean, if you're going out to a specific church and you think this is going to be helpful, my advice, call it guided imagery. Because it's basically the same thing, except you're using some technique to help people heal. But it's basically guided imagery. Do you know we all get into hypnotic states all the time? How we tell if somebody's in a hypnotic state is, one, if they can sit still for a long time. Two, does time get distorted? Think about the last time you were in a great movie. Well, that great movie may have taken 2 or 3 hours on the screen. In your mind, because you really got into it, it seemed like it went by in 20 minutes. Or I don't know if you've ever driven for a long ways, but there's this thing called highway hypnosis, where you like drive through a city, but you don't remember the city. It's like 3 hours later, what happened to the time? And obviously, because you're not dead, you were awake. Biofeedback is one of the coolest treatments. I don't know if you get any training in it, but it is so wonderful. What you do in biofeedback is you hook somebody's body up to computers, and you measure their hand temperature, their heart rate, their muscle tension, how they breathe, even how much their hands sweat, and brainwave activity. And you can see it on a screen. Moment by moment, you can see what's going on in their bodies. And then, biofeedback means you're getting feedback on your body moment by moment. And if I give you feedback on your hand temperature, you can teach yourself how to change it. Typically, with people with anxiety disorders, they have cold hands. Do you know you can actually teach somebody to warm their own hands with their brain? How cool is that? And little kids are very good at it, because little kids don't have the idea that it's hard to do. They don't have the idea that they can't do it. So it's like a computer game for them. Warm your hands. How do I do that? Why don't you just try and see if you can do it? And so, you know, they get these cool images in their head, like, I think I'll get more blood flow to my hand. And they'll make it happen. It's very cool. Now, for adults, you have to give them structured exercises to do. Which is, I mean, what do you think we would do to help you warm your hands? Besides put your hands under hot water. Images. We have people think of warming things. Like, what would be images that you think would help you warm your hands? A hot cup of decaf coffee. That's right. Oh. Hot coffee, hot tea, hot cocoa. Just holding a warm cup. You can already feel increased blood flow to your hands if you do that. What else? The sun. Especially since we, are here in Newport Beach, putting your hands in the sand. Whoa. I love that. Right? Or being out on the patio and just let the sun warm you. What else? Putting gloves on. That'll work. Thinking about, no, because you're doing this just with your brain. So thinking of it, putting your hands in front of a fire. You bet. Or crawling under the covers. A warm bed. Or holding a puppy. Or your cat. Or the hand of somebody that you love who has warm hands. Right? Or holding the body of somebody you love who has a warm back. I mean, you just work with it. And then what you do is you write down these images. And then, now this is why their hand is hooked up to the computer, and you can see moment by moment what's going on with their hand temperature. And then you can go, I don't want you to try to warm your hands. Don't try. Because if you try, they'll get cold. Because it's stressful to try, right? What I want you to do is notice what happens to your hand when you start thinking about these different things. And, maybe the sun doesn't do anything for you. But your puppy dramatically warms you. And so now you're going to be thinking about your puppy when you get upset. And it's a practice thing. We actually send people home with temperature dots. Because you've seen mood rings? They change with the temperature of your hand. And so you can see if somebody's stressed or somebody's relaxed. And it's basically that same simple principle. Biofeedback's a wonderful treatment. You get the opportunity to learn it. The technology is so much better than it was 25 years ago. I mean, you can actually learn to play video games with your brain. That's pretty exciting. Now, from a medicine standpoint, and I think medicine is not the primary treatment for this type. I'd much rather have you meditating and doing biofeedback and getting rid of the bad thoughts in your head than putting you on medicine. Now we use medicines called benzodiazepines, things like Ativan or Xanax or Librium or Valium. Now they're good short term if you're withdrawing for alcohol. They're good short term for panic disorders, but they're not good long-term medicines, and they make your brain look toxic over time. Medicine called Buspar. We often use antidepressants. They seem to help with anxiety. And anti-seizure medicines seem to help with anxiety. And a supplement called kava kava, or another one called valerian root, seem to help with anxiety. Kava kava, though, works like Valium. And over time, your brain doesn't look that pretty anymore. So think of it as a short-term solution. This type of psychotherapy is really helpful. But it's not the kind of psychotherapy where tell me about your childhood, because that just revs them up. Now, you have to deal and understand childhood, but you have to have a mechanism to process the anxiety. So I think with these types, give them skills to deal with it. Because sometimes, if you don't with a panic disorder, they don't go to work. They don't drive. And they may kill themselves. A lot of people don't get that. But anxiety disorders are associated with an increased risk for suicide. Type 2, what we see is too much activity in the deep limbic structures of the brain. In the thalamus, in the medial temporal lobes, in the underside of the prefrontal cortex, sometimes the cingulate gyrus. But in this type where it's pure depression, we see their limbic system just fired up. Now, the limbic part of the brain integrates and gates sensory information, so it allows you to get information in. When it is on fire, which means you're getting too much information in, you are really distracted. People with chronic pain get too much information, and that part of their brain is fired up, which is why they are at risk for depression. Sets their emotional tone, how happy or sad you are. It's involved in bonding. Stores highly charged emotional memories. It's involved with your sense of smell and your interest in sex. So when there are problems in this part of the brain, when it's fired up, people are sad, they're moody, they're negative, they have low motivation. They may be more socially isolated, very common in depression, and they have less libido. So if the limbic area is too low, they may have decreased reactiveness. Too high, depression. They may have cyclic mood changes if they have focal hotspots there. We'll talk about that with one of the later types. They're more risk for pain and sensory overload. The world just comes at them way too fast. So the symptoms, you'll notice these as primary depression symptoms. They're sad. They have little interest in their life. They're irritable. They cry. Now, teenagers might not cry, but they're irritable. They often have guilt and hopelessness, pessimism. They have sleep changes. And in this type, they have trouble. They don't have trouble going to sleep. What they have trouble with is they go to sleep just fine, but they wake up in the middle of the night and they can't get back to sleep. So that's what we think of with sort of classic or primary depression. They have sleep, they have appetite and weight changes. Typically, they're not hungry anymore. And so they may drop a lot of weight. There's an atypical type of depression where they eat a lot and put on weight. They have less energy. They feel fatigued, slowed down. They think of death. They can't concentrate. Now, this isn't like ADD. ADD is you're born with that cluster of ADD symptoms that you have over a long period of time. Short attention span, distractibility, restlessness, impulse control, disorganization. And it follows you. With depression, you might have all of those things, but it goes with the onset of depression. Sensitivity to pain, they're negative. They have low self-esteem. It's like no matter what it is you say to them, they will twist it and take it in a negative way. You look beautiful today. What, I didn't look beautiful yesterday? I'm going to miss you on my trip. You didn't miss me last time? No, I didn't. You see how hard it is to be in a relationship with somebody who has depression. Very hard. And they just don't have joy. They have this sort of persistent feeling of being bored. So the DSM-4 diagnoses are major depression with anhedonia. Anhedonia means you get no fun. Nothing sort of interests you. The things that used to bring you joy, they don't even bring you joy. And dysthymia is chronic, sort of like a chronic low-level depression. Now there's a thing called double depression. It's on our boards. It's a board question. What is double depression? It's where you have dysthymia, and then on top of that you get slapped with a major depression. So this type responds nicely to cognitive behavioral therapy if you got the right type. So we call it ANT therapy. Therapy for your automatic negative thoughts. Exercise is so helpful for this. Physical exercise boosts blood flow to the brain. Increases serotonin availability to the brain. Increases endorphins to the brain. You want to keep your brain healthy? Get your heart rate up every day for a half an hour. Diet. Higher protein, lower carbohydrate diet. And fish oil. I can't tell. I think everybody should take fish oil. highly distilled, high quality, molecularly distilled fish oil. I think it's better for you than fish. Because the fish that you catch in the ocean has mercury in it and other sort of pollutants. You get really high quality fish oil. A brand I like is Nordic Naturals. There are a couple of other brands I like, but you're getting sort of the good stuff that has all the bad stuff distilled out of it. From a medicine standpoint, we use antidepressants. Now, if they don't have a cingulate, we don't use serotonin antidepressants. Increased activity in the anterior cingulate gyrus predicts a positive response to an SSRI, selective serotonin reuptake inhibitor. If you don't have cingulate gyrus symptoms, think about Wellbutrin. Think about something else than Prozac and her 6 sisters. Right? The SSRIs, Prozac, Zoloft, Paxil, Luvox, Celexa, Lexapro, the 5 sisters. The Prozac and her 5 sisters. Those work when you have cingulate gyrus hyperactivity. Okay? Now you're going, but how do you know? Well, do they have cingulate gyrus symptoms? We'll talk about that. From a supplement standpoint, SAMe. I love SAMe. SAMe is a wonderful supplement. It stands for S-adenosyl methionine. It's something called a methylator. It adds methyl groups to other neurotransmitters and raises the levels of serotonin, norepinephrine, dopamine. And you get your joints lubricated at the same time. So if I have somebody who has pain and they have this type of depression, I start with SAMe. People go, oh, supplements, they don't work. They work. You just have to get them for the right type. You see how that's important? You just can't get your supplement information from the 17-year-old clerk at Walmart. Right? But that's what happens. And they go, oh, supplements don't work. They work. You just have to be smart about it. Type 3, much more common than type 1 and type 2. What we call mixed anxiety and depression. They're symptoms of both anxiety and depression. And so the treatments are really a combination. So they would get ant therapy, and they would get fish oil, and they would get exercise, and maybe an antidepressant. So what we see in mixed anxiety and depression is increased activity in the limbic structures, increased activity in the basal ganglia. Very common. Now, type 4 is what we call overfocused anxiety and depression. Overfocused anxiety and depression, increased activity in the cingulate gyrus. The cingulate gyrus is what? It's the gear shifter, the part of your brain that lets you go from thought to thought, move from idea to idea, be flexible, go with the flow. We will talk a lot about this thing, because when it works right, you're flexible. When it works too hard, you're rigid. And a lot of the clients, the patients that you will see over time, have problems with cognitive rigidity. So, cingulate gyrus runs right down the middle of the prefrontal cortex, involved with shifting attention. Cognitive flexibility helps you go from idea to idea, see options, go with the flow, be cooperative with your course director. Helps you be flexible when it works too hard. It's not nice. When it works too hard, you worry. What's a worry? You just get stuck on a thought. Can't let it go. You hold grudges. You might get stuck on a thought. Now, it may be as in obsessive-compulsive disorder, where you get stuck on an ego, alien, awful, terrible thought, right? Like, I can't get near that table because that table has a piece of glass on it. And if I get near the table, I'm going to grab the glass and slit my own throat. Now, even though you've never done anything like that, it's that thought that goes over and over and tortures you. Or you could just get stuck on any thought, like your husband said something insensitive to you, like husbands tend to do. In your mind, you didn't hear it once. He only said it once. In your mind, you heard it 10,000 times. And then you act toward him as if he said it 10,000 times. And you see how this could be a problem in relationships. Get stuck on behaviors. Could be compulsive behaviors, like checking locks or washing your hands or not stepping on cracks. I mean, if you haven't seen the movie As Good as It Gets, you should. It's a great Singular Gyrus movie. I mean, it's really a great OCD movie. You remember the dog who would step over the cracks. There are animals who have OCD. I mean, they actually have dog-eat Prozac. So it might not be as blatant as you washing your hands 50 days, but you may get stuck on pornography on the internet. Or you may get stuck on gambling. Or you may get stuck on alcohol. Or you may get stuck on eating. I mean, you could get stuck on lots of different things depending on your environment. And it's interesting, you know what happens in compulsive gambling? Is people get stuck on their first big win. That's the mechanism. You know, pray to God if you go to Las Vegas and you gamble that you lose. As you're playing blackjack, dear God, may I bust on this hand. Because if you win a lot of money, odds are it's going to keep you there until you put it all back. They also tend to be oppositional and argumentative. This is the thing that makes people crazy. No matter what it is you say, they argue with you. And little children, I see lots of little kids, and they typically argue with their parents. In fact, I asked this question. You should write this down if you're going to see kids at all. How many times out of 10, when you ask a child to do something, will they do it the first time without arguing or fighting with you? And the normal answer, we did a normal study once, the normal answer is 7. 7 times out of 10, children will do what you ask them to do without giving you grief if they don't have learning or emotional problems. If parents say 3 times or less, you need to be thinking about this thing called oppositional defiant disorder. And typically, parents of these kids go, never. Maybe once last month. That is the typical answer. Because no matter what it is you say, they argue with you. I've started, actually, because it's more interesting, start by asking the children. I'm really curious about something. And they'll look at me with their big eyes and they'll go, what's that? How many times out of 10, when your mom asks you to do something, will you do it the first time without giving her a problem? Not very often. And I'll say, why's that? And they'll say, what do you mean? And I'll say, well, do you sort of wake up and plan to be a pain in the neck? No. Do you like it when your mother yells at you? No. Do you like it when your mother hits you? No. Do you like it when you make her cry? No. Then why do you do it? And you know what they say? 100% of the time. Why do you do it? I don't know. Come on, you gotta know. You're doing it. I don't know. And the fact is they don't know. They have no clue. Because it is not, write this down, it is not will-driven behavior. It's brain-driven behavior. I had 2 cases last year. Such interesting cases. These were little boys, 8 years old, from different families, where their parents took them to Disneyland as a surprise on their birthday. And both children had 3-hour tantrums in the Disneyland parking lot. And the second time I'm hearing this story, I'm just like, whoa, a little deja vu here. And I looked at the boy and I said, what was that about? I don't know, Dr. Amen. I said, don't you like Disneyland? No, I like Disneyland, he said. I said, it's okay not to like Disneyland. I said, you know, it's expensive, there are long lines, there's lots of people. And he looked at me like, oh, poor Dr. Amen. He just doesn't get it. I like Disneyland. Then why did you have these tantrums? I don't know. And you know why? He was surprised on his birthday. He had the expectation things would be one way. And when they didn't go his way, not even though he wanted it, didn't go the way he expected it to go, he couldn't stand it. And he blew. And that's what happened. Even stupid things. Like you go to a restaurant, and it's a longer wait than you thought, and everybody's going, let's go someplace else. No, I want to go here. And on the surface, people with this issue appear selfish. So we would give them a moral tag, a moral judgment. You are selfish. When really that's not it. It's they're inflexible. It's like their brain gets in a tunnel. And the tunnel has no windows and no doors. And they feel like they have no options. And you know when people kill themselves? It's when they feel like they have no option. So this type is associated with suicide. And you know, one of the best treatments for oppositional children is to teach parents how to be superior parents and more effective. Because what happens if you let somebody argue with you? They've done studies on people who get into their obsessive thinking. Flames their cingulate gyrus. If you allow your child to ask you the same question, badgering you, for 2.5 hours, you are doing nothing but solidifying this abnormality in their brain. Good parenting is very important. You have to parent for their brain. I mean, one of the things that we do for obsessive-compulsive disorder is a treatment called thought stopping. You know, if you get this thought in your head over and over again, you got to go, stop it, and go do something else, or wear a rubber band and flick it hard. It's like, this is an abnormal thought based on abnormal brain chemistry. I'm not giving into it. And stick your tongue out at the thought. But when you let a child argue with you over and over and over again, you're just making it worse. So in my refrigerator when my children were little, 1 or 2 of them had this natural tendency, I put rules up. And one of the rules was no arguing with parents. Now in parentheses I put, as your parents, we love you and we want to hear your opinion. More than twice constitutes arguing. And so, you know, I want to go to this concert. No. I want to go to this concert. Caitlin, because she was the guilty one. Caitlin, I said no. No matter how many times you ask me, I'm going to say no. But if you ask me again, you're breaking a rule and there's going to be a consequence. And she would like turn around in a huff. But we wouldn't like do this dance that people do. I had one patient said her son would follow her around the house asking her the same question for 2.5 hours. No wonder these kids get abused. And it's often ineffective parenting. So if you're conflict avoidant, okay, you have basal ganglia issues, you're conflict avoidant, and now you have an oppositional child. I want to do this, no. 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 Okay, do it. What did you just teach that child to do? You just taught him to harass you to get his way. It's a very bad thing. If you have no backbone, just say yes the first time. Better to get a backbone, since we are not jellyfish. Now, as you will notice, cingulate gyrus problems are involved in lots of different psychological or psychiatric problems. When it's too low, actually a group of neurosurgeons over at UC Irvine in the 50s described a condition with cingulate gyrus damage, and they called it akinetic mutism. What that meant is they didn't move, akinetic, and they didn't talk. They just were just sat there. When it's too high is usually what we see. They have anxiety disorders, and they can't let go. So this is the person who has a fear of snakes or a fear of ants, who goes to extremes to avoid them because they can't stop thinking about it. Post-traumatic stress disorder. What's that? You get stuck on a traumatic event in the past. Obsessive compulsive disorder. Get stuck on certain thoughts or certain behaviors. Much more common than we used to think it was. Eating disorders. You get stuck on I'm too fat, I'm too fat, I'm too fat, even though you might be 5'7" and 85 pounds. It's stuck on addictions. Drug addictions, alcohol addictions, smoking addictions, gambling addictions, sexual addictions, Los Angeles Lakers addiction. And they can be oppositional. And you know they're oppositional if 9 times out of 10 you say 10 innocuous things to them, they argue with 8 of them. It's a beautiful day today. Oh, it's not that nice. It was better yesterday. When you get that, that's when you have to start thinking about cingulate gyrus problems. And their automatic first response is no. Their position in life, that's where they start, with no. Their first words in life were no. Their first short sentence in life was no way. Their first complex sentence in life was you can't make me do it. Now, how would that upset relationships? They don't cooperate. And if you're parenting one of these children, pretty soon you stop spending time with them. Why? Because you're tired of it. There's no give and take. We spend time with people who return love, affection, attention, and so on. So what we see on scans with obsessive compulsive disorder, or OCD, is increased activity in the cingulate center. We also see it with road rage. Can't stop thinking about that guy that cut you off. We see it also with stalkers. I mean, what's a stalker? Somebody who can't let go. This is the little boy that always said no. When I looked at the scan, I sort of thought this is a behavioral mohawk. He had a mohawk haircut. That's what it looked like in his brain. The mohawk was just an outward manifestation of an inward state. So an over-focused anxiety and depression. They worry. They're upset if things don't go their way. They tend to be oppositional, argumentative. They have repetitive negative thoughts, sometimes compulsive behaviors. They don't like change. They like things the way they like them. They hold grudges. I don't know if you saw in the paper a couple of months ago, the Hatfields and McCoys were still going at it with each other, 150 years later. Can't let go. One has to wonder about the Middle East. If they're not societies that have been traumatized, that have PTSD and can't let go. I think you should get the leaders of Palestine and leaders of Israel in a room. Scan them. Give them some Prozac. Don't let them out. Because what do they do? I mean, it's gotten to the point where it's psychotic. I'm going to go blow myself up because I'm so mad at you. I can't think of anything else. So I'm going to go in the middle of the marketplace in Jerusalem and blow my cell phone. That's crazy. They can't see options. They hold their own opinions. They don't listen to other people. And they say no without thinking first. And that's when you see them in your office, and you will see many of these people through the years. No matter what it is you say to them, they argue with you. Your first interpretation, they're going to go, that's not true. Now what I want you to do, not initially, but after you've seen them for 3 months, is if you've noticed this thing in them, what I want you to say to them is, you know, it seems like no matter what I say to you, you argue with me. And what do you think their first reaction to you will be? No, I don't. At that point, the only thing I want you to do is smile. And then I want you to say, well, you know, that's sort of how it seems to me. What I would like you to do, if you want to get better, I usually throw that in to motivate them a little bit, is I want you to watch your natural tendency this week and see if it isn't to argue. And they go, but I don't do that. And I say, I know you said you don't do it, but I just want you to watch. Whenever anybody says something, if your tendency isn't automatically to formulate an argument in your head against what they said, even silly things. Okay. Because then they'll usually cooperate. 8 times out of 10, they will come back a week later and go, I do that. It's a huge breakthrough, because then you could go, do you want to do that? And they go, well, what do you mean? I said, well, do you want to be a chronically difficult person who's always arguing with people? No. Okay. So when people ask you, just know it's your natural tendency. I mean, we all have natural tendencies to this or that. No, that is your natural tendency. And before you say no, take a breath and go, what's my goal in this situation? Do I need to say no? I have this great example. I was in Washington recently, and a friend of mine said to me, he said, oh, Dan, he said, I'm so grateful for all the things that you've taught me. He's another psychiatrist. He said, especially about the singular gyrus. I'm married to a woman that has a singular gyrus from hell. I said, what do you mean? He said, since I've listened to you, I've realized I never ask for things directly. I always have to ask for things in the opposite. I said, the opposite? He said, yeah. He said, if I want to go to the store, I used to say, honey, would you go to the store with me? And she would always argue with me. I can't go to the store with you. I'm so busy. Can't you see it? That's so insensitive of you to ask. He said, now I never ask for something directly. I say, sweetie, I'm going to go to the store. You probably don't want to go with me. What do you mean I don't want to go with you? Of course I want to go with you. I love you. What's the matter with you? Why would you ever think that? And he said, you know, that really works for them. In fact, there's this thing in family therapy, it used to be called paradoxical intention or paradoxical request, reverse psychology. Ask them to do the opposite of what you want them to do, and they'll do it. But this doctor looked at me and he said, but you know, Dan, I'm having trouble with the sex thing. He said, it doesn't sound right to say, you know, I think I'm going to go have sex. You probably don't want to come with me. He said, do you have any ideas for me? I said, yes, I'm sick. I think about this stuff all the time. I said, yeah, take her out for a pasta dinner. Because what we find for this group, simple carbohydrates seem to be helpful. They make them more flexible. They don't concentrate better, but they, you know, the problem with this is they concentrate too much on the things that bother them. So take her out for a pasta dinner. And then take her for a long walk around the lake where they live. Because exercise boosts serotonin levels in the brain. And then bring her home Give her Godiva chocolate, never hurts. Rub her shoulders, and never ask for anything directly. And between day 4 and about day 16 of her menstrual cycle, you're likely to get lucky. And about 3 weeks later in my email box, I got these, thank you, thank you, thank you, thank you, thank you. I love that story. Their work. Being married to someone who's overfocused is work. And do not make them mad. Don't cheat on them, because they'll never forget it. Right? You got to give them a lot of Prozac, or they will never forget it. All sorts of DSM-4 diagnoses associated with this type, from OCD to what we call OCD spectrum disorders, anorexia, agoraphobia, addictions, oppositional defiant disorder, and Tourette syndrome. People with Tourette syndrome, half of them have obsessive compulsive disorder at least. All right, when we look to treat this type, ANT therapy helps. Thought-stopping techniques help. Exercise helps. Diet helps, but this one more carbs, not the Atkins diet. Not a good idea. Meds, basically SSRIs, and supplements. And the meds, use things like Paxil or Lexapro or Prozac. Effects are if they have low activity in their frontal lobes along with a hot stimulant. For really, really terrible overactive singulates, we'll use the novel antipsychotics like Risperdal. And from a supplement, we'll use St. John's wort or 5-HTP. The next type is what we call cyclic anxiety and depression, where they have focal increased activity in their thalamus, these big hot spots, but usually on one side or the other. And often what we call patchy increased uptake. It just looks like somebody took their hand in paint and threw it on the canvas, and they just got hot spots all over the place, which looks almost like seizure activity. So, it could be as mild as PMS or as severe as bipolar disorder, but what you notice is they have cyclic mood changes. They're fine, and then they're not. They have energy and sleep changes. So at times they may be sleeping too much. That's when they're down. Other times they don't need to sleep because they have lots and lots of energy. They may have grandiose notions when they're up. Or they may have pressured speech or talk too much, racing thoughts, bad judgment, inappropriate social behavior. In fact, you often wonder about, this person never did anything wrong and now they molested their secretary. Were they in a manic episode when that happened? So they often have poor judgment. They can be really irritable, sometimes aggressive, and can be delusional or have psychotic thinking. What you see in bipolar disorder is you see cycles. Now we think of as bipolar 1 or classic bipolar disorder is they're normal for periods of time, depressed for periods of time, and then they're flying high for periods of time. Bipolar 2 is they have rapid cycles. They're not up or down for weeks at a time. They can be up or down for days at a time. So different psychiatric disorders, from bipolar to cyclothymia. Some panic attacks are based on mood cycles. This is our first bipolar brain. Woman who had been diagnosed bipolar, put on lithium. Lithium helped her, but she kept stopping her medicine because she didn't believe she had a problem. After she saw the scan, she stayed on her medicine because she could see it. It was a medical problem. Pattern we call the ring of fire. This is in someone before treatment on the left and after treatment on the right. I mean, that's very exciting to get them better balanced. Treatment for type 5, high protein, low carbohydrate diet, because that tends to lower the seizure threshold and tends to settle down brain activity. The meds we use are anti-seizure medicine. Now, they have bipolar disorder. We don't use Neurontin. It's not strong enough. We'll use things like Depakote or Tegretol or Lamictal. Neurontin is really good for anxiety, for irritability, and pain issues. If they have cyclothymia, Neurontin might be fine. But if you get into a psychotic mood disorder like bipolar 1, Neurontin is just, or Gabatril or Topamax, they're really not strong enough. Sometimes we'll use the novel antipsychotic medicines like Zyprexa or Risperdal, the new one, Abilify, that people like a lot. The next type we call temporal lobe anxiety and depressions, where abnormalities in the temporal lobes. Temporal lobes are a very important part of the brain. They're involved with language and memory, mood stability, listening, reading social cues, rhythm, music, spiritual experience. They're very important structures in the brain. When there are problems in the temporal lobes, you have emotional instability, memory problems, panic attacks, sometimes aggressiveness. And the aggressiveness can be external, I'm going to hurt you, or it might be internal, going to hurt myself. They may have bad headaches, and they often have learning problems. Even though they're really smart, they might have trouble processing what they see or what they hear. Lots of conditions can be involved with the temporal lobes, from learning disabilities to epilepsy to dementia, sometimes aggressive and suicidal behavior. Brain trauma is very common. Too much activity can be seizures, mysticism, spiritual experience. Temporal lobe anxiety and depression is you have anxiety and or depression. Typically you have both, plus temporal lobe symptoms. You might have a short fuse, you might have a rage reaction. Misinterpret information. You may be spacey, have periods of anxiety or fear for no particular reason. Auditory changes, they may be sensitive, a little bit on the paranoid side. You may have headaches or tummy aches. You may have a head injury, family history of violence. The one thing that really stood out for me when we first started doing with this was the dark, evil, awful thought that sometimes came. They may get the diagnosis of epilepsy, or they might have a cyst in that part of the brain, might be damage from trauma. Sometimes they have this thing called intermittent explosive disorder. For no particular reason, they explode. The treatment for this type is biofeedback over the temporal lobes. That can really be helpful to stabilize them. Diet, fish oil, so higher protein, lower carbohydrate diet. The meds we use are basically anticonvulsants. And sometimes if people want to try a supplement, we use the natural supplement GABA, because GABA tends to inhibit overfiring in the brain. The last type, something we call lights or low, overall decreased activity in the brain. And what we see is they might have trouble focusing, spaciness, feel like they're in a fog. They get overwhelmed by their life. They just don't have the mental energy. They feel sluggish, they procrastinate, they're bored, they lose things, they're distracted, forgetful, have trouble planning, trouble expressing empathy and their feelings. Now notice, we have a diagnosis of depression. Can be major depression. One brain is hot, one brain is cold. The treatments are not the same. One you want to calm down, one you want to fire up. So it's important to know the differences. So often this one they'll get a diagnosis of depression with cognitive impairment. They may get a diagnosis of ADD, but it's really due probably to some sort of toxic substance. Maybe chronic fatigue syndrome. This is an example of chronic fatigue syndrome. Not nice. This is a relatively new scan that we did on a woman that was very depressed. She had a heart attack when she was 18 years old. And she had a loss of oxygen for a number of minutes. And you can just see, I mean, the severe damage overall in her brain. We're doing hyperbaric oxygen treatment with her. I'm excited to see after 4 or 5 weeks if we'll actually see a change in the scan. The treatment for this is you got to get better blood flow to the brain. There's a treatment called transcranial magnetic stimulation. They take powerful magnets, put it over your skull, and increase blood flow and activity to that part of your brain. Sometimes biofeedback can help. Hyperbaric oxygen treatment, where they put them in chambers to really drive oxygen into the cells. Exercise can help. Diet and fish oil. The medicines we use, things that stimulate people. So we might use Ritalin or Provigil or Strattera, things like that. There's no question you can have mixed types. This is a 17-year-old boy who came to us. He had, when he was 3, he had a cerebellar tumor. And he had the tumor taken out. But they had to go back for a second surgery, and after the second surgery, he developed a brain infection. He developed meningitis. And it basically killed a lot of the function of his temporal lobe. And from the time he was 3, 17 now, he's had terrible epilepsy. Some months he's had 45 to 60 different seizures. And he's been on multiple medications. His parents are very sweet. They actually run the Tustin Center, which is a school dedicated to children who've had brain injury. And as I sort of listened to the story, I went, there's no way this kid is optimized, because he still has OCD. He still has a lot of anxiety. He's still very sad. And so the neurologists have been focused on the seizures and not focused on his mental health. And so when we scanned him, which you see is this is his scan, the image on the left, terrible temporal lobes, especially on the left side. Terrible problems with his temper. But he has to have things his way. Things don't go his way, he explodes. And the one episode they talked about was waffles. He wants waffles in the morning. And Mom ran out of waffles one morning. And he chased her around the house with a knife for 45 minutes. Now you look at his scan, you go, he's got terrible temporal lobes, and he's got the cingulate gyrus from hell. And you understand why people do. So here you have to target the temporal lobes, because we always target the temporal lobe or cyclic type first. I should write that down. Target the temporal lobe or cyclic type first. And then you can go after the cingulate gyrus. If you get it backwards, you may in fact make these people much worse. You remember recently the FDA had this big hearing about antidepressants in children. Antidepressants cause suicide in children. The FDA is asking the wrong question. Do antidepressants cause suicide in children? Yeah, the wrong ones do. Just like they cause suicidal behavior in adults. Right? You might not remember, but 12, 13 years ago, there was this big hoopla in the media about Prozac makes you kill your mother. Not usually, but if you give it to the wrong person, it can make them aggressive. The same thing's true with children. So if you have the temporal lobe type or a cyclic type, you got to treat those first, because if you don't, the serotonin medicines can make people crazy. Got to get the treatment in the right order. Now, when we assess these types, clinical history is the best thing. You can't get a scan. You're going to yourself, I can't get a scan. How is this helping me? I'm giving you the symptoms for each type. Right? You need to screen them for. Now, collateral information is helpful. Get information from the schools, for kids, from siblings, spouses, parents, and watch how it develops over time. If they were fine and then they had a head injury, that could trigger it. If they were fine and they had a stroke or they had a heart attack, that could trigger it. If they were fine and they got a new job in a furniture factory, now they're around solvents all day, that could trigger it. We have a very nice checklist I'm happy to share with people. You can email me and I'll send it to you. It's specifically for anxiety and depression. It comes out of my book, Healing ADD, Healing Anxiety and Depression. DSM-4 is useful, but it just doesn't honor underlying brain physiology. Also look at their response to medicine. You give them an SSRI like Prozac, and they say, I'm happy, but I have no motivation. Well, you can just bet you've taken down their cingulate gyrus too far. Okay, let's talk about treatment. So how do you treat anxiety, depression, and bipolar disorder? Seriously. Well, I think that's important. You take these seriously. They ruin people's lives. Suicide is the 8th leading cause of death in the U.S., and it's the 3rd leading cause of death among teenagers. So don't minimize them. The first thing that I think is important to do is educate people. So, I encourage our patients to go to conferences, lectures, get really, really great books like the one I wrote. Get on good websites and learn about it. Support groups help. If you run a group for I used to run a group for people with anxiety disorders. I loved it. They were fun, and they learned a lot, and the social support was helpful for them. It's my support group. Yosemite, pretty place. Nutritional treatments, I encourage them to be on healthy diets, because your brain, as the rest of your body, makes itself new every 5 months. So you literally are what you eat. So you might as well be putting good things in, like blueberries and spinach and walnuts and broccoli and lean protein, rather than milkshakes and pastries and Starbucks. And I'm going to get myself in trouble with Starbucks someday. The cingulate types do better with a more balanced diet, leaning a little bit more towards simple carbohydrates. There's a wonderful book on that called Potatoes, Not Prozac. Supplements, we talked a little bit about them, but if you have low prefrontal cortex problems, we think of L-tyrosine as being very helpful. A hot cingulate, we use St. John's wort or 5-HTP. Limbic problems, SAMe or DL-phenylalanine. Temporal lobe problems, we use GABA. If you have a cyclic mood disorder and all the rest, I recommend high-quality fish oil. I take 2 every day. It's called Nordic Naturals Pro Omega. I think it's just got a great blend of the right kind of omega-3 fatty acids. I think it's very important to pretty much teach most of your patients this thing I call ant therapy. It's how to think. How to think in ways that are helpful. And it's based on some very simple principles. The first one is every time you have a thought, your brain releases chemicals. Every single time you have a thought, your brain releases chemicals. Every bad thought you have releases bad chemicals that make you feel awful. How do we know that? Well, we hook people up to biofeedback machines and we go, think about these 5 things. And if they're bad things, their hand temperature gets colder, their hands sweat more, their muscles get tense, their breathing rate gets fast and shallow, their heart rate goes up but flattens out. There's no heart rate variability, which is a sign of heart health. They've also done brain scans on people thinking about positive things or negative things, and what they find, that changes the brain. So what you think about moment by moment matters. When you have good thoughts, happy thoughts, hopeful thoughts, your brain releases a completely different set of chemicals that make you feel good. The Apostle Paul was right. Think on whatever is pure, right, lovely, good, excellent, worthy of praise. Let your mind dwell on these things. And it's a training exercise to bring your mind back to what is healthy. Because, thoughts are automatic. They just happen. They're based on complex chemical reactions and memories. And they lie. And they lie a lot. Your patients and clients are filled with thoughts that just aren't true. But they have no clue because no one has ever taught them you don't have to believe every thought you have. They're just thoughts. I taught a class for 3rd graders once called How to Think. And it amazed me how these little 8-year-old kids were filled with negativity and erroneous thinking. And what do we teach them in school? We teach them how to factor before we teach them how to correct the bad thoughts that go through their head. This should be right up there with the alphabet. Because it's what ruins people's lives. It's not what other people do to you. It's what you do to yourself. And it's really simple. You just tell people you don't have to believe every thought that you have. And I can teach you how to take control over it. So, This is Gary Larson on different personality types. Top left, the glass is half full. She's all excited. Healthy brain. Probably my mother. The guy on the right, the glass is half empty. He's angry. He's got limbic problems. The guy on the bottom left, half full. No, wait, half empty. No, half. What was the question? He had a cingulate gyrus problem. And the guy on the bottom right, hey! Ordered a cheeseburger. Temporal lobe problem. He forgot! This is what you do. You tell your patients, your clients, whenever you feel sad, whenever you feel mad, whenever you feel nervous, write out what your thoughts are. And you write out what happened, what's the event, and then write out your automatic negative thoughts. And then see if you can't identify them as one of these species, one of these different types. One of my patients drew some of these for me. This is a mind-reading ant. Where you arbitrarily believe you know what somebody is thinking even though they haven't told you. I have to tell you, I have 25 years of education. I can't tell what anybody's thinking. A negative look from someone else may mean nothing more than they are constipated. You don't know. I know a lot of you think you're very intuitive. Right hemisphere, hey, big right hemisphere. Forget it. You can't tell what people are thinking. It's way too complicated. The next one is fortune telling. Your anxiety disorder patients, they're filled with fortune telling. Fortune telling is where you look at a situation and you predict the worst possible outcome. And then you don't stop there. You then make it worse. Guilt beatings, where you think in words like should, must, ought, have to. Now, of course, in life there are shoulds and shouldn'ts. Of course there are. But if you try to motivate behavior with guilt, it won't work. It's much better to say, what's your goal in this situation? Rather than you should do this, or you shouldn't do that. So the exercise again, whenever you feel sad, whenever you feel mad, whenever you feel nervous, write out what you're thinking. So, one day we were seeing a patient from China. And I was really nervous. And I went, this is going to be really hard. And then I caught myself. And I wrote this down. This is going to be a difficult patient. And then I wrote fortune telling. How do I know? I haven't even met him yet. It's possible. It could be a really great experience. And then I wasn't anxious. Because I was correcting the bad thoughts going through my head. So feed good thoughts to your anteater. You should go over to the UCI bookstore and buy yourself a little anteater. You know, that's their mascot. It's the anteater. You should buy yourself an and just put it in your office somewhere to remind yourself, one, when you feel sad, mad, or nervous, write out what you're thinking, correct it, so you can deal with the situation with better brain function. And two, it's a very useful analogy to talk about with patients. Biofeedback we talked about a little bit. It's very exciting, where you can teach people to warm their hands, breathe with their belly. Meditation is the same way. And it requires practice. It's like you have to do it on a regular basis, like a good prayer life. You can't just like do it at Christmas. Something that you need to practice on a regular basis. And the 18-40-60 rule, again, is very helpful for anxiety disorder people. You're 18, you worry about what everybody's thinking of you. When you're 40, you don't care what anybody's thinking of you. And the truth is that when you're 60, you realize nobody's been thinking about you at all because they've been thinking about themselves. When I have patients that have panic disorders, I write this out on a prescription. One, don't leave. If panic disorder patients leave, they don't ever come back. The anxiety begins to take control over them. Now, leave if it's dangerous. But if it's not dangerous, say you're like at the mall, you're going to have a panic disorder and they leave, it's like, don't leave. Start breathing with your belly, slowly, deeply, mostly with your belly. Kill the fortune-telling ants, you're probably predicting something bad is happening. And then medicine. But don't think of medicine first. It's not a good idea. This is one of the computer screens in our biofeedback equipment. And we're hooking up their belly and their chest, and we can actually watch it moment by moment, how they breathe. And we see that nice and deep, slow, very cool. And then with their eyes closed, I went, think about the last time you were angry. And look what happens to their breathing. Completely decompensate. Now, just knowing that, getting feedback on that, they can change it. So when they feel anxious, they can go, I've practiced diaphragmatic breathing. 5 deep breaths, they're already beginning to feel better because now they have oxygen. See, when you're not breathing, no oxygen, your brain's unhappy. Because your brain cells start to die after 4 minutes if your brain doesn't get proper oxygen. The dark side of anxiety, depression, and bipolar disorder, suicide, is very common. Sometimes people cut on themselves, often to mask pain or to cover abuse. If you have a cutter, you need to screen them for dissociative identity disorder or multiple personality disorder. Many cutters have underlying dissociative disorders. Violence is common, and drug abuse is common. These are family illnesses. Anxiety and depression increase divorce. They increase domestic violence. It's important, because they run in families, to evaluate family members and include them in the evaluation and the treatment process. Because if the spouse is bonded to you, the spouse may help them get you, the client, to their appointments. The spouse has never met you, and you're dealing with somebody who goes home and says, oh yeah, the therapist thinks you're a bozo. The spouse will undermine the therapist. So I think it's good that you get people in and you at least meet them and say hi, and you get the information that the other person has, because often patients do not report things as accurately as you would like. How's everything? Great. And it really may not be great at all. Well, what do you do if things don't work? Well, one, the diagnosis might be wrong. Or you're treating them with depression, and what they have is the lights are low and everything is low, and you're treating them with an SSRI. So you might have the wrong type, or the wrong medicine, or there are things that interfere with treatment. Like they're taking their medicine with orange juice, and orange juice can sometimes deactivate the medicine. Or they're taking generics when brand name works better for some people. For some people, generics work better. For some people, brand name works better. In my mind, they're just different. After being a doctor for 20 years or 22 years, the medicines are just different. Sometimes they don't follow through enough. They go and they don't come back. They go and they don't come back. Or they try to cut corners. So just some things to think about. Depression increases your risk for Alzheimer's disease. Untreated depression doubles the risk. Now, sometimes untreated depression, as we talked about, can masquerade for Alzheimer's disease. So if you're working with the elderly, it's a very important concept to understand. Now, why is exercise good for mood? Because it increases a whole bunch of good things. Blood flow to your brain. It increases your neurons' ability to deal with stress. It increases serotonin to the brain. The brain deals better with free radical formation. And everything is better with exercise. Okay. So in summary, anxiety, depression, bipolar disorder, they're highly treatable if you understand the subtype. Accurate diagnosis can make a dramatic difference, save money, lives, improve generations. They're wonderful people to treat because they usually get better. Well, with adult ADD, there are a lot of people who are not properly trained, a lot of therapists, psychologists, and psychiatrists. And so they get diagnosed as personality disorders. They get diagnosed as having bipolar disorder, even though they've never been... Hey, I'm going to wear this, Jesse. So bipolar disorder, personality disorders, anxiety and depression, they get all those. And those treatments don't make them better. Our clinic does medicine and supplements. We'll recommend other treatments and try to help people find resources to get them. Because, you know, we think our job is informed consent. Is to tell you what we think the problem is and give you the options to work on it. And, you know, some people won't take medicine. So you can't go, oh, well, you have to do that. You just have to go, well, these are your other options. And these are the pros and these are the cons of each option. And you always want to stay that way with your clients. You don't want to tell them what to do because, we have enough trouble being responsible for ourselves. But you want to give them good information. Tommy had a left temporal lobe problem. That was his primary problem. So with left temporal lobe problems, we use anti-seizure medicine to try and stabilize them. And isn't it interesting, in the last 30 years in psychiatry, we've been using more anti-seizure medicines, almost more than neurologists use. Because what we find is they stabilize mood. They decrease temper. They decrease anxiety. Depakote, Lamictal, Neurontin, and so on. Type 4 is one of the most common types of anxiety and depression. This is the type that responds to serotonin medicine. Almost all of them. If you're over-focused, almost always you have both anxiety and depression. Say that again. It manifests both ways. The question is, how will this play out with a child pornographer? They get stuck on it. They just can't shift. And so even though they hate themselves, because a part of them knows it's wrong, they go back. It's like, have you ever been bowling? And you know, in the bowling alley, there's a reset button. And, you know, say the pins don't come down or whatever, and you go, okay, hit the reset button. For these people, it's like the reset button is stuck. And so you can't do anything because you're getting those images back over and over and over again. I have a friend who works at the Buena Vista Correctional Institute. He's the medical director there in Colorado, Buena Vista, Colorado. And after he listened to me, he started putting all of his child molesters on serotonin medicine. And he just had some great stories about how they would stop thinking about it all the time. So the question is, in the court system, if you can demonstrate that this is a medical problem that potentially has a treatment, how do you judge them? What do you do? As in Los Angeles 2 weeks ago, in a death penalty case. And this guy, one of the two murderers he committed, he was in a bar. And he was Hispanic, and somebody disrespected him. And his machismo got all out of whack. And he went home. And he got a gun. And he came back. And he shot him dead. And the prosecutor went, he planned it. And I'm up there. He had really hot cingulate gyrus. And I went, it's sort of like a vinyl record. Remember vinyl records? That has a big scratch in it. And it's like all he could hear was, he disrespected me. He disrespected me. I'm going to kill him. I'm going to kill him. That's not good planning. What I said in court, I said, it's bad planning. He's here. Right? He didn't even know this person. Right? When one would think that is bad planning. He got life without the possibility of parole. They didn't kill him. Very happy about that. Now, I mean, at some point, you still have to hold people responsible. But there are levels of responsibility. You know, we do not all have the same level of free will. I wish it was so. It would make the court system and judgment so much easier. But that's why the Bible says, don't judge other people, because it's complicated. If somebody doesn't have too much activity in the anterior cingulate, and they take an SSRI, so the question is, how would it affect them? Well, it would sort of calm everything down. So say it's normal to start in front. Taking an SSRI will calm it down even further. So they're going to have motivational problems. They may have cognitive problems, concentration problems. So if you give somebody who typically has ADD an SSRI, you take down their anxiety, but you also take down their frontal lobe. So they're worse, but they don't care that they're worse. The question is about Elavil. There are a lot of side effects with it. Now, some people do great with it, and they don't have any problem. Dry mouth, constipation, blurred vision. Never take an overdose of it, because it's nasty if you do. But, you know, periodically I'll use it for headaches as well, because it tends to be... Does it work for you? If it works. Sometimes it'll dry up their bladder. They get an atonic bladder, doesn't, you know, can sort of settle it down. Yeah. Yeah, at least as antidepressants we have many better ones.